Okay, so what can I do for you today?
So I feel like I definitely need Botox to freshen up, and I also have asymmetry. I'd like to have a more symmetrical face.
Perfect, great. Okay, so what I'm seeing is a slight hemifacial asymmetry between your brows. So your right brow is higher, the left one is lower, so almost kind of makes the eyelid look a bit heavier on the left side. And also the jaw, so the masseter's muscle, there's one side which is bigger, so your left side of the masseter's is more pronounced, which is very normal. So what we can do, what I can help you with some neurotoxin, which is the Botox, is to basically improve the asymmetry. So essentially I'm going to activate the muscle that elevates your left brow more, so that can get improved while also the lines get softer, and then we can improve the asymmetry of the jaw just by evening out the strength of your jaw muscle called the masseters. So all of that will be done with Botox. So 10 injections, you're barely gonna feel anything. It's done in 5 minutes, and it will take 2 weeks to fully kick in. Amazing. Okay. Hi guys, I've got Fae with me today. So she's interested to improve the asymmetry of her brows. So there's one brow which is a little bit lower, and what actually works really well to improve that, if not sometimes to correct that completely, is tiny injections of neurotoxin, so which is Botox. So essentially the way that works, we keep the higher brow where it is, and then we activate the muscle that elevates the lower brow with the toxin. So by doing so, we can improve asymmetry really well. So in her case specifically, not only she suffers from bruxism, which is the teeth clenching and grinding, but also she does that asymmetrically. So on one side, her jaw is bigger. So what we can do to improve that is actually injecting some neurotoxin known as Botox in both sides, especially higher dose in the bigger side. So in that way, we can slim down the jaw, correct the asymmetry beautifully for 3 months. So I'm just gonna mark the face to treat the brows asymmetry with toxin. So yeah, there you go. So let me measure exactly. So the right brow is about 3 centimeters lower. That's fine. So I'll try to improve that with the toxin, and just lift your brows up again for me. Lovely, and just relax entirely. Thank you. And then smile right here. Lovely. So clench really hard for me, keep clenching, so tiny shelf scratch coming, well done. Relax, and clench again for me. Smash up again. Lovely, perfect. Well done, clench again for me. Keep clenching, yeah, well done. Excellent. And then just frown really angry and just relax entirely. Shelf scratch. So in her case, the left brow is about 3 millimeters lower. So the way I can improve that with toxin is essentially by relaxing the muscle that brings the brows down, which is this area here, the frontalis muscle, and then I leave the sides completely without the toxin so that this side can elevate slightly and lift, while in the meantime I slightly do some micro units on the right side, so we keep the right brows exactly where they are, whether the left one will elevate and fix. So all that will kick in the next 3 to 5 days, but to see the final result it will take around 2 weeks.
Run around in my head. I can't let go. No, 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 no. It's all I think about, think about, think about, think about, think